1. The nurse should delegate the task of assessing a patient's wound to a UAP. True or false? Answer: false. Rationale. Assessing a wound requires clinical judgment to evaluate signs of infection or healing, which is outside the scope of practice for unlicensed assistive personnel UAP. The nurse must perform assessments to ensure patient safety and accurate care planning. 2. The priority nursing action for a patient with a respiratory rate of 8 breaths per minute is to administer oxygen immediately. True or false? Answer: true. Rationale. A respiratory rate of 8 indicates respiratory depression, a critical condition requiring immediate intervention to maintain airway and breathing, per the ABCs: airway, breathing, circulation. Administering oxygen supports respiratory function and patient safety. 3. It is appropriate to delegate the task of repositioning a patient every 2 hours to a UAP. True or false? Answer: true. Rationale. Repositioning a patient to prevent pressure ulcers is a routine task within the UAP scope of practice. The nurse ensures the UAP is trained and monitors skin integrity, supporting safe delegation and patient safety. 4. The nurse should prioritize a patient with chest pain over a patient with a fever of 101 degrees Fahrenheit. True or false? Answer: true. Rationale. Chest pain may indicate a cardiac event, a life-threatening condition that prioritizes circulation in the ABC's framework. A fever of 101 degrees Fahrenheit, while concerning, is less urgent unless accompanied by critical symptoms. 5. A nurse can safely delegate the task of administering oral medications to a UAP. True or false? Answer: false. Rationale. Administering medications requires clinical judgment and is outside the UAP scope of practice. The nurse must ensure accurate administration to prevent errors, prioritizing patient safety. 6. Hand hygiene is the most effective way to prevent healthcare-associated infections. True or false? Answer: true. Rationale. Hand hygiene is the cornerstone of infection control, significantly reducing the transmission of pathogens in healthcare settings, as supported by CDC and WHO guidelines, ensuring patient and staff safety. 7. The nurse should assess a patient with a blood pressure of 200/110 mmHg before a patient with a scheduled dressing change. True or false? Answer: true. Rationale. Severe hypertension, 200/110 mmHg, indicates a hypertensive crisis, a life-threatening condition requiring immediate assessment to prioritize circulation and prevent stroke or organ damage. 8. It is appropriate to delegate the task of monitoring a patient's vital signs to a UAP. True or false? Answer: true. Rationale. Monitoring and reporting vital signs is within the UAP scope of trained. The nurse interprets the results and makes clinical decisions, ensuring safe delegation and patient monitoring. 9. The nurse should always prioritize a patient's airway over their circulation in an emergency. True or false? Answer: true. Rationale. The ABC's prioritization framework places airway first, as a compromised airway can lead to immediate death. Ensuring airway patency is critical for patient survival in emergencies. 10. A nurse can delegate the task of teaching a patient about their new medication to a UAP. True or false? Answer: false. Rationale. Patient education requires clinical knowledge and judgment, which is outside the UAP scope. The nurse must provide teaching to ensure accurate information and patient safety. 11. A patient with a pulse oximetry reading of 85% should be assessed before a patient with a temperature of 102 degrees Fahrenheit. True or false? Answer: true. Rationale. A pulse oximetry reading of 85% indicates hypoxia, a critical condition requiring immediate assessment to prioritize airway and breathing, per the ABCs, over a fever, which is less urgent. 12. The nurse should stop in for infusion if the site shows signs of infiltration. True or false? Answer: true rationale. Infiltration can cause tissue damage and medication delivery issues. Stopping the infusion prevents harm, prioritizing patient safety, and allowing for site assessment and intervention. 13. It is appropriate to delegate the task of applying a clean dressing to a UAP under nurse supervision. True or false? Answer: true rationale. Applying a clean dressing is a technical task within the UAP scope if trained and supervised. The nurse ensures sterile technique and monitors wound status, supporting safe delegation. 14. The nurse should prioritize a patient with a new onset of confusion over a patient requesting pain medication. True or false? Answer: true rationale. Sudden confusion may indicate a neurological emergency, such as stroke or hypoxia, requiring immediate assessment to prioritize neurological stability and the ABCs over pain management. 15. A UAP can be delegated to check a patient's bed alarm settings. True or false? Answer: true rationale. Checking bed alarm settings is a safety task within the UAP scope. The nurse ensures the alarm is functional and assesses fall risk, supporting patient safety through delegation. 16. The nurse should notify the provider immediately if a patient's potassium level is 6.5 milliequivalent/L. True or false? Answer: true rationale. Hyperkalemia, 6.5 milliequivalent/L, risks life-threatening arrhythmias, requiring immediate provider notification to prioritize circulation and initiate treatment, ensuring patient safety. 17. It is safe to delegate the task of ambulating a stable patient to a UAP. True or false? Answer: true rationale. Ambulating a stable patient is within the UAP scope if trained. The nurse assesses stability and monitors for complications, ensuring safe delegation and mobility support. 18. The nurse should prioritize a patient with a respiratory rate of 32 breaths per minute over a patient with a scheduled insulin dose. True or false? Answer: true rationale. A respiratory rate of 32 indicates potential respiratory distress, requiring immediate assessment to prioritize airway and breathing per the ABCs over a scheduled insulin dose. 19. A nurse can delegate the task of interpreting a patient's ECG to a UAP. True or false? Answer: false rationale. Interpreting an ECG requires clinical judgment and specialized training outside the UAP scope. The nurse must perform this task to ensure accurate diagnosis and patient safety. 20. Standard precautions should be used for all patients regardless of their diagnosis. True or false? Answer: true rationale. Standard precautions, including hand hygiene and PPE when needed, are applied universally to prevent infection transmission, as per CDC guidelines, ensuring patient and staff safety. 21. The nurse should assess a patient with sudden shortness of breath before a patient with a routine dressing change. True or false? Answer: true rationale. Sudden shortness of breath may indicate a pulmonary embolism or respiratory failure, requiring immediate assessment to prioritize airway and breathing per the ABCs. 22. It is appropriate to delegate the task of emptying a urinary catheter bag to a UAP. True or false? Answer: true rationale. Emptying and measuring catheter output is a technical task within the UAP scope. The nurse interprets the output and assesses for complications, ensuring safe delegation. 23. The nurse should always obtain informed consent before delegating any task to a UAP. True or false? Answer: false rationale. Informed consent is required for procedures, not delegation of routine tasks like hygiene or monitoring. The nurse ensures tasks are within the UAP scope, prioritizing safety. 24. A patient with a blood glucose level of 50 milligrams per deciliter should be prioritized over a patient with a blood pressure of 140/90 mmHg. True or false? Answer: True rationale. Hypoglycemia, 50 milligrams per deciliter, risks seizures or coma, requiring immediate intervention to prioritize metabolic stability, while mild hypertension is less urgent and less symptomatic. 25. The nurse should stop a UAP from performing a task if they are not following infection control protocols. True or false? Answer. True rationale. Failure to follow infection control protocols risks pathogen transmission. Stopping the UAP and providing education ensure patient safety and adherence to standards. 26. It is appropriate to delegate the task of checking a patient's oxygen tubing for kinks to a UAP. True or false? Answer. True rationale. Checking oxygen tubing is a safety task within the UAP scope. The nurse monitors oxygen delivery and patient status, ensuring safe delegation and respiratory support. 27. The nurse should prioritize a patient with ventricular tachycardia over a patient with a fever of 100 degrees Fahrenheit. True or false? Answer. True rationale. Ventricular tachycardia is a life-threatening arrhythmia requiring immediate intervention to prioritize circulation, per the ABCs, over a low-grade fever, which is less urgent. 28. A nurse can delegate the task of developing a care plan to a UAP. True or false? Answer. False rationale. Developing a care plan requires clinical judgment and nursing expertise outside the UAP scope. The nurse is responsible for planning to ensure patient safety and quality care. 29. The nurse should verify a patient's identity using 2 identifiers before administering medication. True or false? Answer. True rationale. Using 2 identifiers, e.g., name and date of birth, ensures accurate patient identification, a critical safety measure to prevent medication errors, per Joint Commission standards. 30. It is appropriate to delegate the task of applying a hot pack to a patient's joint to a UAP. True or false? Answer. True rationale. Applying a hot pack is a non-invasive task within the UAP scope if trained. The nurse ensures proper application and monitors skin integrity, supporting safe delegation. 31. The nurse should prioritize a patient with a new onset of slurred speech over a patient with a scheduled antibiotic dose. True or false? Answer. True rationale. Slurred speech may indicate a stroke, requiring immediate assessment to prioritize neurological stability and the ABCs over a scheduled antibiotic dose, which is less urgent. 32. A UAP can be delegated to perform sterile wound irrigation. True or false? Answer. False rationale. Sterile procedures like wound irrigation require clinical judgment and training outside the UAP scope. The nurse must perform this to ensure infection control and patient safety. 33. The nurse should notify the provider if a patient's hemoglobin is 7G/DL. True or false? Answer. True rationale. A hemoglobin of 7G/DL indicates severe anemia, risking oxygenation and requiring provider notification for interventions like transfusion, prioritizing circulation and safety. 34. It is appropriate to delegate the task of assisting with a patient's bath to a UAP. True or false? Answer. True rationale. Assisting with hygiene is a routine task within the UAP scope. The nurse monitors skin condition and ensures patient comfort, supporting safe delegation and care. 35. The nurse should prioritize a patient with a pulse of 140 beats per minute over a patient with a minor laceration. True or false? Answer. True rationale. Tachycardia, 140 bpm, may indicate shock or arrhythmia, requiring immediate assessment to prioritize circulation per the ABCs over a minor laceration, which is less urgent. 36. A nurse can delegate the task of evaluating a patient's response to pain medication to a UAP. True or false? Answer. False rationale. Evaluating medication response requires clinical judgment outside the UAP scope. The nurse must assess pain levels and adjust care, ensuring patient safety and efficacy. 37. The nurse should ensure bed rails are raised for a patient with a history of falls. True or false? Answer: true. Rationale. Raising bed rails reduces fall risk, a key safety measure for high-risk patients, as supported by fall prevention protocols, ensuring patient safety and injury prevention. 38. It is appropriate to delegate the task of monitoring a patient's intake and output to a UAP. True or false? Answer: true. Rationale. Monitoring and recording intake and output is within the UAP scope. The nurse interprets the data for clinical significance, ensuring safe delegation and patient monitoring. 39. The nurse should prioritize a patient with a new tracheostomy dislodgement over a patient with a scheduled dressing change. True or false? Answer: true. Rationale. Tracheostomy dislodgement risks airway obstruction, requiring immediate intervention to prioritize airway and breathing per the ABCs over a routine dressing change. 40. A UAP can be delegated to adjust a patient's 4 pump settings. True or false? Answer: false. Rationale. Adjusting 4 pump settings requires clinical judgment and is outside the UAP scope. The nurse ensures accurate infusion rates to prevent errors and prioritize patient safety.